Welcome to Frontline, a program or a section of the program where we focus on those at the front lines of this fight. So as the world battles the coronavirus pandemic, which has now claimed over 200,000 lives, health workers continue to brave the odds to offer patients some lifeline. More than 10,000 of them have, however, succumbed to the disease. As we build up to our broadcast of our latest documentary, Inside a Treatment Center Tonight, Komla Adom puts the spotlight on life at the front lines, which features two doctors at the University of Ghana Medical Center who are giving it all up to offer medical care to persons with coronavirus at the facility.
Many times, doctors, nurses and other health workers feel invulnerable, but it is hard for them now to see their colleagues who have caught the coronavirus die in other jurisdictions. But it is a commitment to serve humanity that is keeping hope alive, and it shows how brave these people are for showing up every day and doing their work.
My medical director in particular cares about the people, and while his jurisdiction is the doctor, so I can speak only as a doctor, and they make sure that you take care of yourself. I have one colleague who, as we say in Chinga, it's not many just to Dr. Susan Siabi, but she makes sure that I do the right thing. Sometimes I forget I'm going to hug someone and said, I'm a social distancing or this, or I'm a, you looked at it. We look out for each other. Someone doesn't see you for a couple of days, you get a call to make sure that everything is okay.
I am Komla Adom, and I have come to the University of Ghana Medical Center, where I have been granted exclusive access to visit the treatment facility for persons with COVID-19. I meet Dr. Emmanuel Amoah and Dr. Amma Edwin, who are directly offering care to some of the patients in this facility. Before they go into the treatment facility, they need to be appropriately gowned. In fact, personal protective equipment, what we famously call PPEs, are precious now, probably counted like narcotics. But it is for good reason. We're about to find out how much.
We are going to wear our full PPE. The reason is simple. When we go in there and then anybody needs any care, because we are in full PPE, we can offer the level of care, the needed care for every patient. If you are not fully donned, then when you go in, there may be some procedures you may not be able to do because we are not in the appropriate personal protective equipment.
But Dr. Amoah and Dr. Edwin do not don their PPEs unguided.
We have supervisors here whose sole responsibility is to make sure that healthcare workers are donned properly before they go to offer service. So they will read you the steps and you dress appropriately before they can tell you that now you are okay to go. So now we are going to turn you today also to frontline health workers, possibly give you the full PPE for you to appreciate what healthcare workers go through when they need to offer care for COVID-19 patients.
You know me, I told you that I'm up for this. No problem at all. I'm ready to also, don the PPEs. It's going to be a revealing, experience for me as well. So what you are seeing now is a session where the doctors are donning their full PPEs, of course being supervised by people who are designated to supervise the donning of the PPEs. As you can see, it's actually not a child's play here. I did not check the timer, but this careful and thorough process lasted more than 30 minutes for us all. I have to tell you that it's not an easy process. My camera technician, Sami Asante, is here with me. Sami, are you sure you can breathe?
I'm managing.
And I'm going to go in the treatment area with Sami Asante, also with Dr. Emmanuel Amoah and Dr. Amma Edwin. Come with us. These doctors and nurses do not just walk in and out of a treatment facility.
You have to plan the care. What exactly are we going to do in there? So that when you go in with, let's say, a doctor and a nurse, you'll finish all that has to be done for the patients before you come out. because we want as minimum exposure as possible.
Dr. Amma Edwin has taken the lead. She's interacting with some of her patients and probably seeking their consent to have us come by.
We have some of our patients here who are willing to talk to you.
These two patients are doing well.
And how are you doing?
I'm doing better. Yeah, sure, everything is going well and we are under the treatment and we are getting better.
I actually wasn't breathing properly, so I had to come in so that they can monitor me properly with oxygen and so on, support.
Akai and Polo, as I choose to call them, say the health workers, including Dr. Amwa and Edwin, have been truly helpful.
As I'm here for past 1 week now. I was suffering a breathlessness, but because of the doctor's team over here and the staff management, I'm getting better over here.
Oh, doing well. The doctors have been very supportive, and the jacks have been working, so we're fine.
It's been several hours.
You want to cut the full documentary inside a treatment center tonight on the JoyNews channel right here. We are free to air, remember? So tell your friends to tell their friends to tell their girlfriends and their boyfriends and their family members to watch at 8:30. It's certainly intriguing and it'll give you an idea what our health personnel go through. So you stop people who do so, stop stigmatizing them, and also patients as well. So after they do all of these, what do we tell them? Listen.
I think now frontline we have a lot of definitions, but now if we limit ourselves to COVID-19, then I think everybody, you even standing here, you are also frontliner. So all the frontliners, nurses, doctors, so military, the police, and everybody who is into the fight of this COVID-19, I say are equal to them for the wonderful work they have started doing, continue doing, and they will continue to do. I pray and plead that they shouldn't relent on their efforts, because it is a fight that we all need to put in our maximum effort and strength. It is not over until it is over. So all frontliners, we say God bless you, but let's continue to fight harder.
You know, we talk about heroes and heroines and so on. And these are the people who are sacrificing every day to go to work to combat this virus. It's not an easy thing. Knowing that you are leaving the house, you may or may not get infected. There's a 50-50 chance, but yet they do go. And for that, as a nation, we are really grateful. They have done very well in sacrificing. I hear some have even come out of retirement to help, handle the situation. So to all the health workers, we are very grateful.
I mean, the message to the frontline health workers to me is really, I would like first to commend their job. I think they've been doing a great job since this outbreak of COVID-19. I want them to continue to support and to help all the patients. And we would all pray so that this does not last too much, and make sure that they continue their hard work. And I also want to make sure that their family continue to support them. But like I said from the beginning, the frontline people are the health workers today on this COVID-19 thing. But we are all part of it, So we should all support them and bring whatever we can to make their job easy as we go forward.
On behalf of the people of Accra, I wish to thank our frontline officers who have been at the forefront of the fight against this COVID-19. Our special thanks to the health workers, doctors and nurses, and all allied workers. Our military and police had done a yeoman job by maintaining high security in our communities. The media personnel that had also been all this while dedicated their time to educate and inform the citizenry how to act in a more responsible manner. And all other workers, including us as politicians, who have had sleepless nights and promise to serve the people of Accra, being on the front line. I'd like to thank all of you once again for your continued service to the state, and I want to repeat what His Excellency the President said. This too shall pass. Thank you.
And that's it for Frontline, and I can't say it better than all those people. We'll keep honoring you here. Those of you at the front lines, will keep dedicating this time to you, to hear your stories, to share your stories, your concerns with the rest of the world, to seek answers, and to also encourage you. This has been Frontline.